Hi there, you are listening to Incorruptible Mass. Our mission is to help you transform state politics. We know that together we can make Massachusetts policy reflect the needs of the vast majority of the residents of our beautiful state. And today we are going to talk about Medicare for All in Massachusetts. We got an amazing question from a listener about how we pay for single payer in Massachusetts. So that's what we're talking about today. But before we do, we have some amazing guests on the show today. Stephanie Kelton and Gerald Friedman. They're going to let them introduce themselves in just a second. First, we love having our regular co-hosts come on first for a brief introduction, and I will start with Jordan.
My name is Jordan Berg-Powers. I use he, him, and I have several years experience in politics in Massachusetts and lots of years angry that we don't have single payer.
And Jonathan.
Jonathan Cohn, he, him, his, joining from Boston, coming on a decade of issue and electoral advocacy in Boston, and a nice context to tell you, as Jordan did, my first statewide electoral campaign was for a candidate who was advocating for single payer in Massachusetts.
I am Anna Callahan, coming at you from Medford, she, her. And I have to first apologize. I just said Stephanie Kelton because Stephanie Kelton comes up in the quote, right, from the listener. Well, we have Stephanie Nakajima on, which I'm so excited about. And so let me go on right now to introduce Stephanie Nakajima from Mass Care.
Yeah, sorry, not as exciting a guest as
Stephanie. Oh, as exciting.
Yeah, I'm Stephanie I'm the executive director of Mass Care, the Massachusetts campaign for single payer. John, I had no idea your first campaign was on single payer. I knew we had a special connection.
It was Don Berwick 2014.
Oh, Don
Berwick. And we also have Gerald Friedman.
Hi, I've been at this since 1979 when I went to Washington with Michael Harrington to support Senator Kennedy's national single-payer bill. So I'm a professor of economics at UMass Amherst, and I've written a bit about economic history, labor history, theories of economic activity, and single-payer.
Fantastic. Thanks so much to you both for being on. We're very excited about this one. We are talking about the implementation and the financial implementation of Medicare for All single payer in the state of Massachusetts. How do we pay for it in a state? So we had an amazing, wonderful, deep question from a listener, and I'm going to read that question for everyone. Thank you for your podcast. I'm glad that progressives are taking on these serious issues. This is from Glenn Coate. My question is about implementing Medicare for All in Massachusetts. Stephanie Kelton is a leading economist in modern monetary theory who served as a Senate Budget Committee under Bernie Sanders' chairmanship. She writes, unlike the federal government, individual states really do need to find the money to pay for their spending. And Glenn Coate claims, Vermont signed into law the nation's first single-payer health system back in 2011, and it collapsed in 2014 due to financial reasons. If Medicare for All or a single-payer health system were to get signed into law in Massachusetts, and if it were to collapse a few years later like it did in Vermont, it could feasibly condemn us to several more decades of corporate profiteering, of exploiting vulnerable populations and milking their finances dry for having the audacity to get healthcare when they need it. How can Massachusetts implement universal health insurance coverage in a way that gets people the care that they need, doesn't break the bank, and therefore sets up a good example that other states can follow and hopefully lead to the federal government to stop dragging its feet and implement universal health care that this country so desperately needs? I'm concerned that the progressives on the left are not being as thoughtful or strategic as we could be regarding the issue of implementation. Maybe you could use another millionaire's tax to pay for it. This time without the legislature countering it with $1 billion tax cut for the rich. Thank you all for what you're doing. Sincerely, Glenn Coate. And Glenn, we want to also wish you happy birthday, which is coming up next week. So we're wishing you happy birthday now. But also thank you so much for this incredibly thoughtful question. And I want to go ahead and invite our guests to begin the discussion about Medicare for All, the costs of Medicare for All in Massachusetts, and how we pay for that.
Well, I'll dive right in. I think that I hear this all the time, and I've spent 15 years addressing how we can afford to pay for single payer, either on the national level or on state levels. I've written reports for about 15 states on how to do this. And I understand people are very concerned about how we're going to pay for things, but it always strikes me as a little odd, because every study, there have been journal articles, meta studies reviewing all the different studies. Virtually every study of single payer programs finds that they are less expensive to operate, even after taking account that they cover all of the population and provide real universal access by doing away with deductibles and copays. So the real question should be not how can we afford single payer, but how can we afford the current system, which is more expensive while providing less care? If we can afford the current system that costs approximately twice as much per capita as other countries spend on universal coverage, then we can certainly afford something that's cheaper and better. Now, within Massachusetts, there are literally billions of dollars of waste, first of all, in the private insurance system itself, all the advertising, utilization review that drives doctors out of the profession, making it harder to get to see anybody. Plus, within hospitals, I go to Dana-Farber for my care, and I'm very happy to be able to do that. And I love Mass General system. It's wonderful, but it is 4 to 5 times as expensive for the same services. And we're not talking about specialized cancer care. We're talking about simple fixing upper arm fractures, wounds, simple appendectomies, uncomplicated births. All those things are 4 to 5 times as expensive within one of the elite hospitals, one of the so-called must-have hospitals, as elsewhere. There are monopoly profits being made in these hospitals, squeezing those profits out. And then we get to the drug companies, big pharma. Oh, I don't need to tell anybody about how overpriced our prescription drugs are in this country. Even when they are off-label, off patent, even insulin. Oh my God. And people die because of this. So when we talk about the cost of healthcare, we really should be including in the cost of healthcare, and I'm an economist, so I am allowed to be ghoulish. We should be including in the cost of the current healthcare system the cost of burying the hundreds of thousands of excess deaths in the United States.
Yikes.
Plus the economic loss from people dying prematurely.
I love that, Jerry. I think, with this commenter, he asks, maybe we're not being as thoughtful or strategic about how we implement Medicare for all. But actually, I think we need to be more thoughtful and strategic about the fact that our healthcare system is a moral failure. And this sort of question is what happens when you allow the concern trolls, right, to dictate the terms of conversation. This is just a financial problem. Actually, our healthcare system is a financial problem, but more than that, it's a moral failure, right? And so I think that it's really important that we always bring it back to the problem of, the fact that we don't have universal healthcare in our country. We have crazy stories about people even having insurance, not being able to get their teeth taken care of, losing their house when they get cancer. All of those things, I think that is the problem. And once you decide that that's the problem, then financing is the secondary thing that you then jump into and figure out, okay, we know we have a problem. How are we going to finance it? And then the good thing about Medicare for All is you've decided you have a problem. Well, the answer fiscally is also, Medicare for all. That's the way you finance a universal healthcare system. It's the only way that universal healthcare has ever been successfully implemented anywhere in the world. There is no such thing as a private universal healthcare plan.
And go ahead, Jonathan.
Just very quick thing that the mention of burial costs reminded me of. One thing that I often think of when it comes to kind of health insurance coverage in Massachusetts is back in 2018, when the Massachusetts Senate was debating a bill that would involve expanding coverage. One state senator, Richard Ross, who owns a funeral home in Rentham, voted present on expanding mass health. Now, I think that part of it was because of funerary benefits that exist in coverage. But for the longest time, when I saw that, I was like, you own a funeral home, so you're voting against you think something that keeps people alive longer is bad for business. And yes, that the actual conflict of interest was probably much narrower, but I always think about that anyway, because the larger conflict of interest still does exist.
Mm-hmm. Yeah. And I want to get us, so we've had a whole discussion about Medicare for all on this program, at least one. And I want us to talk a little bit about what happened in Vermont, right? I think there are some misunderstandings about what did happen in Vermont. Jerry, if you can give us a quick sort of rundown of what happened. It was, 2011 to 2014. So tell us a little bit about this, because I think there are misunderstandings.
Yeah, I was in Vermont at the time.
Great.
I've had a regular gig as a consultant to the Vermont State Employees Association, which are not responsible for anything that I say here, and occasionally consulted with the state legislature on various economic issues. And I'm a taxpayer in Vermont. I have a ski timeshare. And I was in Vermont at the time that the governor pulled the plug on the single payer program. And I thought, oh my God, I am going to be spending the rest of my life explaining what just happened. Yeah. And it's been true. It comes up all the time, and there's a lot of misunderstanding. First of all, Vermont never implemented a single payer program. In 2011, I believe it was, they commissioned a report by Jonathan Gruber at MIT and Bill Shao at Harvard Public Health, two of the best people you would want to do something like this. And the report concluded that the best way they had several alternative paths, and they said the best path is a single payer program. All you need to do, and this is economists speaking, all you need to do is put in an 11.5% payroll tax. You'll be able to cover everybody, and you'll be able to do it more cheaply, a little bit more cheaply than what you're doing now. You have to have an 11.5% payroll tax, which is the biggest tax increase in the history of Vermont. So the legislature kicked it over to a commission, the Green Mountain Care Board, which did their thing, came up with a program. This is how we could do it. And guess what? We're going to need an 11.5% payroll tax. There was an election. The gubernatorial election went to a runoff. The Democrats lost badly. They held on to the legislature, but the Republicans campaigned, the Democrats will raise your taxes. And they were scared. The Democrats were scared. The governor fell on his sword, knowing that he wasn't going to go anywhere in the future politically. And he killed the single payer plan on behalf of the legislators because nobody wanted to pass the payroll tax. Basically, what happens is you pass a tax and you tell the public that they will be saving money after taking account of the tax. People believe the tax. They believe they'll have to pay the tax, and they have doubts about whether they're going to be saving the money. That is a major problem we have. Plus, the tax and the savings are targeted at particular people or particular institutions. You raise taxes, basically rich people are going to be paying more in virtually any tax that you come up with. And rich people are a concentrated group of people with political leverage. And the institutions that would be losing money because of the program, health insurance companies and big hospitals and big pharma, they all get together. They know each other. This is small groups. They focus their energies on stopping this. The beneficiaries, who especially include poor people, working people who can't afford deductibles and copays, the people who die young and go to that nursing home Jonathan was talking about, those people don't have the political energies. And the people who benefit the most are the disabled, the needy. They're kind of working on getting through the day. So that's what happened in Vermont. It was a political problem, not an economic problem. Everybody could look at the report and see that this would save money and this would save lives. But that's not what the politics were about.
Yeah,
I just want to go really quickly and just say that I think the important thing to note is that what it looked like is the hospitals got together and started threatening the state. They started saying, we're going to move out of the state. We're going to collapse. And I think the important thing about this also that's important for those of you listening is that then what happened is that the media repeats right-wing talking points without question. It repeated these absolutely, totally undefensible thoughts, positions, the idea that hospitals would close, the idea that doctors would leave, the idea that wait times would go, things that are easily proven, right? Let alone you just look around the world. They repeated those things without question and immediately caveat anything about single payer. So they will run articles that just say almost word for word what the right-wing talking points, what the hospital said about the fear, and never allow the ideas of like study single payer. Like they don't talk to Gerald in the news media about single payer. They don't talk to economists. They don't allow economists to be the final say, experts to be the final say. They allow executives who have a financial interest to be the final say. My favorite article, I saw this, NPR did a classic NPR sort of report on this. They interviewed regular people who were for it and hospital executives as the expert. This is a classic NPR tactic, which is to allow the left sort of regular people, if the people who will affect, to speak as the quote unquote experts from the left, and the right attitude are allowed to be the people in charge, the people who are responsible, right? So it juxtaposes the rabble, the stupid people, the people we look down on, the not intelligent people who just don't understand that we can't afford to give them healthcare, right? With the, we would love to do it, but it's just not fiscally responsible. And they never allow an economist or an expert. They never allow right-wing thinking to be challenged. And I think that's really important because that goes on consistently and would go consistently here. We would have to be prepared for that when we do this here, to not just win on the merits. We would also have to go absolutely directly at the media and call them on the lies that will inevitably be copied and pasted into their things, the fear mongering, because it's not just, to Harold's point, the executives that hang out with each other. It's not just the insurance companies that band together. The rich people include everybody who owns those newspapers. The rich people includes every single person who makes six figures appearing on television. They all also, they are all on the same boards. They all hang out with each other. The Channel 5, Channel 7, Channel 10 anchors, they all are on boards with executives of hospitals, of insurance companies. They're friends with them. They're not friends with you. They don't know you. And so I think that that's a really important point to this, is that it's like it's the whole thing that comes at us. And I think that's the other piece for Vermont, that we weren't as prepared as we should have been for that piece of it. How quickly they would band together to spread lies.
Stephanie.
Oh,
sorry, Joe. You want to jump in with one line, Jonathan?
Yes, just very, very quickly. Jordan, your comments about how like the hospital executives talk about how, we would really want to yada yada, reminds me of a spin on something that I said recently that was a spin on something else, that like hospital executives like to be socially in favor of people getting healthcare, but fiscally anti people getting healthcare.
Exactly.
And Stephanie?
Yeah, exactly. And these are things that, as the director of mass care, I think about a lot. Like, how are we going to actually overcome all of these problems that we're going to face when we pass Medicare for all? And of course, what you're saying, we just saw that with the Fair Share Amendment, that the Globe was awful. So, it's not like it's going to be any different here, and it could even be worse for all of the reasons that you just said, Jordan. And I just think that when I reflect a little bit on what happened in Vermont, one mistake they did make was campaigning entirely on the ideological principle of healthcare as a human right, which absolutely I believe should be the focus. But I think that because they dragged their feet a little bit on like doing the taxes and the explanation of the taxes, and they didn't go out to, some of the big players like the unions and, even the Globe or the media there, and explained that this is how the taxes work. And now you at least know, and make sure to bring them on board, get that buy-on immediately before you put something on the ballot or before it goes to the legislature. Those are the things that we need to make sure we're doing, because the support for Medicare for all must be both broad and deep in order for us to be able to counteract what's going to be coming at us from basically the whole upper class, the wealthy class, and the corporate class. So that's just something that I think in Massachusetts we're really cognizant of what went wrong in other places, and join mass care. Come on.
Awesome. And I'm going to jump in and say a little something about media as well, which is that we understand where larger media organizations will fall on these questions. And that's why we exist as Incorruptible Mass on this podcast. We are here to make sure that as many people as possible can hear the real deal about how we actually pay for Medicare for all, about what really happened in Vermont, and we need for you to support this program. So as we talk about how you pay for things, how you pay for this program is you can jump in. We'll have a link right below. You can put in $5 a month. You can put in $50. You can put in anything you want, really. So if you love us and you want to spend a little more, that would be amazing. Please do donate to the show so we can continue to bring you the real deal and the facts about important issues like Medicare for all and all the other issues that you care about. So I do want to, at this point, have Jerry, have you explain in the most unwonky and easily understood terms how this particular bill, right? So we've had a bill in the legislature for 40 years, in the Massachusetts legislature for 40 years. And I don't know how often the payment plan for it has changed, but I don't think it's that often. Like other countries pay for this. We're not going in as if, we're just passing Medicare for all with no plans on how to pay for it, right? There's a plan. It's already there. It has been well thought through. And Jerry, I would love if you could give us a sense for where does the money come from to pay for universal health care?
Well, it's actually not that difficult, and I'll try not to be wonky at all about it. We have a certain amount that we are already spending as a commonwealth. That includes a lot of waste. We're assuming that we can get that waste out of the system.
And by the way, do you mean as a commonwealth, do you mean the state government?
Yes.
Right.
Yes. The state, the state government plus what people are paying in private insurance premiums, plus the money that comes in from the feds for Medicare, for a half of Medicaid, and for some other programs. We have that money coming already budgeted, so to speak. And then that includes paying for a lot of these wasteful activities, like the bureaucracy in the private insurance system. The waste, you go into your doctor's office, stick your neck around the corner and look at all the people there, nurses, sometimes the doctors themselves, who spend hours every day or every week, often at night, interacting with the insurance companies, justifying their medical decisions. A friend of mine years ago said, I have to give my patients what they need after all my years of education. I have to get on the phone to some snot-nosed high school graduate in Omaha. Okay, I'm sure it's a nice person in Omaha. And explain to him why I know what's best for my patient when they don't know anything about it. And I have to be nice about it.
So we understand there's a lot of waste, but
yes,
give us, where does the money come from? So the money is going to come
waste
from
out. Figure we're going to be spending more for some things because more people will be covered.
Yep.
We have money coming in. The Fed's already paying for our Medicaid. They're paying for the Medicare for the seniors and disabled. And you subtract the waste from the total spending now. You have a certain amount that we will be spending on the Medicare for all. Take out what we'll be getting from the Feds. And what you're left with is the budget hole. In Vermont, it was 11.5% of payroll. Here, it would be less because we're a wealthier state. So we figure about roughly 10% of payroll, plus some increased taxes on unearned income. That is income that you get from stocks, dividends, etc. Businesses will be paying less than they're paying now. Currently, businesses pay about 10% of payroll, plus their employees pay 3% of their salary for health insurance. They'll be paying 7.5% and 2.5%. Plus, people won't be paying for deductibles and copays. Plus, businesses won't be paying hundreds of millions of dollars that they now spend for consultants to interact with the health insurance industry. So businesses will be better off. People will be better off. They'll be able to go to the doctor. And there are two hidden benefits here. One is the state government and local governments pay a lot more for health insurance than do private employers. So while private employers will be saving money, the state, the Commonwealth, and local governments will be saving even more. And we're talking about billions of dollars in savings that could go to education, that could go to roads. The roads in Amherst are abominable. They could go to other activities.
The roads in Medford are abominable.
Oh, I bet we're worse.
Everybody.
So I think it's important to note, like, thinking about some of the ways that there's waste in the system. I think a lot about the fact that, like, first off, all these health insurance companies are publicly traded, so they have to make more income every year than they did the year before. More income is your money that you paid to go to get you well, going to private money in Wall Street, doing nothing in the system. Absolutely nothing in the system, right? And then
it's worse because things are getting worse.
Right.
They're squeezing more and more out of the system. And that is also driving doctors out of the system.
I was going to say that next. Yeah.
Oh, sorry. Yeah.
No, it's just like, and so you think about like all of that money that gets spent just directly out of just immediately, like if you think about money going out, right? The first tranche of it just immediately goes to Wall Street, goes to some investor without doing anything. Yes. Then you add into it all of the money that's going to administering all of these things. And then on top of that, because we don't have a single payer system, our hospitals are profiteering more than ever. So now you're getting into the health insurance companies. I joked with their lobbyists that I feel bad for them. These hospitals are too big. They're clearly not big enough to compete with the Mass General system. So we need to get rid of them and have somebody else bigger compete with these hospitals, because that's another source. And the hospitals themselves that are quote unquote are now for-profit systems that are absolutely pulling money out of the system. And so just to what Jared and I are about to talk about, which is the time on. So my best friend growing up as a kid wanted to be a doctor. The only thing she's ever wanted to do is be a pediatrician. And she is allowed, according to her nonprofit, because she works at a nonprofit hospital, she's allowed to spend 6 minutes with a child before, and she gets written up. She gets written up if she spends more than 6 minutes. In that 6 minutes, because she's also a child psychiatrist, she's supposed to diagnose their mental health, diagnose their physical health, And if she spends more than 6 minutes, her nonprofit hospital writes her up for not spending enough time. And her whole
Spending
life,
too much time.
spending too much time. Her whole life, the only thing she wanted to be is a doctor. She cannot wait to pay off her medical fees so that she can leave. And she says she doesn't know a single millennial doctor who isn't planning to leave when they run. Like, forget retirement. Like, there's a lot of older folks in the system. There's a lot of Gen Xers and baby boomers in the system. She's like, forget those people. They're staying to their 60s. She's like, there's not one millennial who will stay that long. She's like, they're all going to leave too, because 6 minutes, that is how much time she's allowed to spend before she gets in trouble, right, with her employer about how much time she's spending with these people. And this is the system. And so think about when you're with your doctor, if you've ever been frustrated that they don't know you, that they're not hearing you, that they're trying to just give you a bunch of drugs and get out of the room, it's because they could be in trouble if they're not doing that. Let alone that even if their own private practice, they got to get out of that room because they got to go around and fight with the insurance to get you even the bare minimum that they think they can do with you.
Yeah. And the insurance companies love this on several ways. First of all, making the experience of going to the doctor less pleasant is another barrier to access, so we don't go.
Yep.
Secondly, doctors go looking for something else to do because they can't stand practicing medicine. So it increases the supply of labor to the insurance companies. So some of these doctors go into utilization review because that's a relatively easy life. And then the hospitals, you're absolutely right. The hospitals are, they call them not-for-profit. That just means not taxed.
This just means not taxed.
Yeah, they're piling up billions in reserves,
and they're offshore.
It just means that there are no shareholders that get the profits that they extract at the end.
Right,
and
so
it's always wild to me that they get counted as not for profits when they act like a for-profit corporation. Yep. They just don't have like dividends and shareholders who the extra profit would go to. It just fuels the pay of executives.
Same culture.
Hospitals in Massachusetts are non-profit hospitals in Massachusetts are hundreds of millions of dollars short on their free care spending, which is supposed to be, I believe, 2.5% of their gross. They're way below that because, they're not for profit, but it doesn't mean that they're doing anything for giving anything back to the community. What they do is they give us more advertising, which is another way of buying access to the media companies.
So I just want to say really quickly, just because I want to put a really fine point on this. So the nurses, when they were going through their battle to try to have more time with patients, the nurses wanted more nurses so they could spend more time with patients. They found that the Boston hospitals were offshoring a lot of their profits to Dubai, to the UAE, to Saudi Arabia. That Boston's Children's was building systems outside of other places and using profits from Boston. And to be clear, it's just the Boston systems that are nonprofits. Worcester has a for-profit tenant corporation who is basically a criminal enterprise pretending to run a hospital. Tenet, the corporation that owns our hospital, has had a Medicare fraud or a Medicaid fraud case nearly every year of its existence. Nearly every year. The Bay State Hospital system in Western Mass, if you want to know why we don't have single payer, they own your Western Mass representatives. They own them. Your Western Mass representatives will sign on to single payer and will never vote for it because they are scared to death of the Bay State Corporation, a for-profit hospital system, which is the largest employer in Western Mass, threatens them on a regular basis, tells them they will close up shops, has closed up hospitals already without repercussions because the elected officials will say one thing in public and in private say, please don't hurt us. Please, we'll do whatever you want. We won't regulate you. We won't actually come down. We won't actually stop you from closing beds, even though in the public we're saying that we will literally go behind the doors. You have a state rep in Pittsfield, go out and tell the nurses to get back to work, right? Tricia Foley-Bouvier told the nurses to get back to work, sided with the hospital because she knows who pays her paycheck. She knows who keeps the jobs in Pittsfield, right? She is threatened more by that hospital than she is the workers, the voters, the people in there. And so I think that's an important point that yes, Boston has fake not-for-profit hospitals, but most of Massachusetts doesn't even have that pretense. We have straight up corporations who are making money off this system and literally in some cases stealing from taxpayers without real repercussions. They'll pay fines a quarter, like nothing, pennies on what they've stolen from the system, right? They don't care.
We just saw an example of this, not in Massachusetts, but in Minnesota, where the state legislature was on the cusp of enacting a nursing staffing bill. And the Mayo Clinic, just straight out said, well, if you do this, we're going to take our investment that we're going to be doing in Minneapolis and we're going to move it to another state. And eventually, after a couple of days, it didn't even take that long, this legislature caved and exempted the Mayo Clinic from the staffing bill.
Of course.
Yeah.
So on this depressing note, Stephanie, do you want to jump in with something?
Sure. So I just think that there's so much here to talk about. I mean, everybody has touched on things that we could go on for hours about, including corporations controlling hospitals and what's happening to staff and everything else. But just to give, I think that, the main thing that I want to get across today is that we keep coming up against this question of how we're going to pay for Medicare for all, which I think is exactly the opposite of the actual situation we're faced with right now with our healthcare system. We have an outrageously expensive private healthcare system that is literally threatening the entire economy. We are losing, even from an economic perspective, we're losing business to Canada on the border because it's cheaper to do business in Canada because of healthcare costs. And you're asking us how we're going to afford Medicare for all. The question is, how are we going to continue to afford this dumb cat brain health system where we say, oh, we want to let markets do it. But then we also recognize, on the other hand, actually, we can't just let people die without giving them health insurance, at least to some extent. So we just throw money at the problem. We just throw money to private entities to keep the ball rolling. And, I think we just need to recognize that we have been terrible stewards of our healthcare dollars, and that single payer is the only rational way we can get a handle on outrageous healthcare costs and, actually give quality health insurance where people can see the doctor for more than 5 minutes at a time to everybody, because that is the reality. All you have to do is you have to look outside of the country of the United States and see that that is the reality. When I used to live in Denmark, I would go to the doctor. We had a 45-minute slot to see my GP. Sometimes it would take the whole 45 minutes. Sometimes it would take 30 minutes. And then my doctor always wanted to ask me where he should go to Japan on holiday. I had a relationship with my doctor. And that's just the reality. And every other every other country has universal health care where they focus on primary care. They make sure people have the care they need. They make sure costs don't get out of control. They don't let corporations call the shots. It's so easy.
Jordan.
Oh,
Jonathan.
Good job.
Just one quick thing, Stephanie, that your point about how especially the delays in care lead to rising costs just reminded me how important that of a point is, that when you have a system like single payer, you're better able to do preventative care because there's no people have an incentive to go on a regular basis rather than viewing it as a deterrent and a possible cost. Because I was just thinking of it's if you notice a leak in a roof, if you fix it immediately, it's going to cost a lot less if you wait until suddenly your entire roof has collapsed, and then you need to collapse the roof. You can't get away with not fixing the collapsed roof, so that you then it costs far more money than if you had done it up front. And that leads to kind of a lot of the inefficiencies in the current system and how things can get more expensive because all of the incentives are in favor of them waiting and snowballing cost.
Yep.
We have a criminally high number of amputations in this country because of runaway diabetes. And that does largely affect people of color and communities of color. And it's an absolute shame that happens.
Yeah, I'll just say that the thing that gives me the most hope is that this system is so stupid, it will collapse on itself. It just cannot have a system where the only people who have jobs are are hospital executives and insurance executives. And that's the system we're going to as younger people, Gen Z and millennials, don't become doctors. If we won't have doctors and we won't have people in this system, and people are leaving because they're just tired of it and don't want this thing, it will, that's the thing that gives me hope, is that this system is so stupid, it will eventually collapse on itself. It cannot continue this way because it does not work in any stretch of the imagination. And we need to be smart about capturing some of this energy that people have. There is not a single American, there's not a single Massachusetts resident that doesn't have a horror story about the health insurance, healthcare, health insurance, private care system, right? Like everybody has a horror story, and we just need to we need to both capture that energy. I like to joke that we jump right to single payer, but I always say, like, actually, we just need to get people riled up and angry with pitchforks, and then we can figure out how to fix it. You want people to pay an 11% tax. Tell them who's stealing that money right now and where it's going. And so, like, I just think that's going to be the hope, is that this system is so stupid, it will not last. And we have a real solution that will save money and make people's lives better. And we just got to figure out how to get people riled up enough to want to change it.
Absolutely. Thank you all so much. We have a plan for paying for it. It's a very simple plan. It's always been in the plan. Nobody's being irresponsible. Nobody's pie in the sky. Like, it's very simple, and it will be cheaper for everyone when we actually implement Medicare for all. Cheaper for the state government, cheaper for city governments, cheaper for you, cheaper for me, cheaper for all of us. Thank you so much, everyone. It has been a fantastic conversation. I really appreciate your time. And thank you to all of our listeners. We look forward to talking with you again next week. Hey there. Thanks so much for watching us on YouTube. Please like and subscribe. And it would be amazing if you would also subscribe to us on your favorite podcast player. Just look for Incorruptible Massachusetts wherever you listen to podcasts. Thanks so much.